Okay, so welcome to another Fireside chat video. In this video, what I want to talk about and show you is a self-treatment for people that have what's called gallbladder deficiency, and this often shows up in people that have had their gallbladder removed. Now, people that have gallstones or cholecystitis, inflammation of the gallbladder, what I often see is that they get a referred pain in between the shoulder blade and the spine in the upper back, often on the right side, and often this goes right up into the neck. And in some cases, I'll explain this to people and they'll say, well, you know what, Cynthia, I actually don't have a gallbladder. I had my gallbladder removed. And that's when I explain to them that even though they had a gallbladder removed, there can still be inflammation along the channel, and definitely from the removal, right? Because basically that's a hole at the end of the channel. The gallbladder channel connects to the gallbladder. Once that organ is cut out, then you have a gaping hole, which automatically means that there's a deficiency along the gallbladder channel that, of course, people are going to have for the rest of their life. So when this gallbladder gets removed, there are a number of symptoms that can happen for them throughout their life. So things that can show up after a surgery of this sort are bloating, indigestion, abdominal pain, upper right quadrant pain, diarrhea, heartburn, jaundice, nausea, vomiting, gas, difficulty digesting fatty foods. So this can either be like an immediate feeling of indigestion, and it can also show up as like fat floating in the toilet. Sorry for the description, but to be really clear. And so a great acupuncture point that we can use with moxa is right on the gallbladder channel here. It's this point called gallbladder 40. So this is specifically for deficiency. And so if this is you, you've had your gallbladder removed, I'm going to show you a moxibustion technique. So first of all, I'm going to just put some moxa cream here on the point. So where this point is, you want to find this on yourself, is it's at the anterior of the external malleolus. That's this great big ankle bone here. So anterior to that, the front, but also a little bit inferior, there's a great big gap. As you can see, I'm just pressing here. It's a great big like depression here. That's where you're going to go. Okay, so you're not going to go down here below the malleolus. Okay, and you're not going to go way over here. That's the stomach channel. This is the urinary bladder channel. So it's in between in this big depression. Okay, so I put some moxa cream down here to protect my skin from the heat. And then the next thing I'm going to do is I'm going to use this Japanese moxa. So here, I'm just going to show you here. Here we have some moxa wool that then gets rolled into little cones. And this is called rice grain moxa. So I've gone ahead here and rolled some cones. You can see there. So I'm going to put a moxa cone right into this moxa cream here, okay? And then I'm going to grab my incense stick. I'm going to light it here. Okay, so I've got that lit, and I'm going to use my lit moxa stick. I'm going to apply it to the end here, and I'm going to just light that moxa cone. It's going to burn down, and that heat is getting transferred down through the foot here, and then it's going to make a little bit of a zigzag across the side of the lower leg. Now, when there's a gallbladder deficiency, we're going to see a few signs. So in addition to some of the symptoms that happen when the gallbladder's been removed, we might also see, sometimes people have puffiness in this area. Sometimes the puffiness, I've seen it, it can be huge, like, you know, an inch out. So this is a type of stagnation. When the energy is very deficient, it can become very stagnated. We can also sometimes see a roughness or a dryness to the skin here. Now, I've got a little bit of that. I've got it on my other foot a little bit more, but it has improved quite a bit. I still have my gallbladder, but you know, so issues can show up along the channel and right on the skin level, and so that gives us always some indication that something is going on with the channel. So you can get symptoms along a whole pathway, and I'm just going to add another cone here. I'm going to just put these two together and light this next one. So it's not simply the gallbladder in the Western medical terms, it's also the channel that it's connected to. So this is the energetic pathway that the energy has to flow along. So when there are issues, they may be issues with the organ, or can just simply be a channel issue that's going to be easier to fix. But nevertheless, in this case, the whole organ is missing, but we can still help to balance the body from this problem by balancing the channel, working with the channel itself. Okay, so in this case, we're using a heat treatment. So the heat is a type of energy. That energy is moving into the channel, it's penetrating through the skin, and it's providing more energy to that gallbladder channel. And this point in particular, gallbladder 40, is especially indicated for gallbladder deficiency and when people have had their gallbladder removed. So what I would recommend for people that have had their gallbladder removed, I would recommend doing this, doing moxa. You're not going to be doing this type. This is Japanese moxibustion technique. You're going to be using a moxa cigar, so imagine a bigger version of this, and you're going to be just what they call bird pecking onto the, or around the point. So you can go above the point like this, or you can do kind of a circling technique. So you're only about like about an inch away from the skin with your moxa cigar. And you would do that with the moxa cigar. You would do that say 30 minutes 3 times a week. So you're going to do 15 minutes on one point, on one foot, and 15 minutes on the other foot. So the points are all bilateral. So you're gonna have 2 points to work with. Okay, so then you can do that treatment 2 or 3 times a week and see how you feel. If symptoms are not getting better, you may need to balance both the liver channel and the gallbladder channel at the same time. So you may need to see an acupuncturist for that. Okay, so there you have it.